Today we're talking about eating disorders commonly associated with young girls, but young boys also suffer with them. In fact, 25%, Leah, this stat of young people with eating disorders are male.
Yes.
I didn't know that.
No, it's shocking to a lot of people.
This it's a staggering stat. I had no clue.
I know. This is why we do these stories. This is very exciting. So we spoke with the medical director of the Calgary Eating Disorder Program, and she says, yes, in fact, 25% of boys suffer from eating disorders. And in fact, it's actually quite a similar disease in both boys and girls. The main difference it would be in boys is that they're less preoccupied with the thinness that girls are preoccupied, and the boys are more preoccupied with fitness and achieving that muscular ideal. But the obsessions and what these boys do to achieve that ideal body that they have in their mind are very much the same.
The similarity involves the preoccupation with body, the preoccupation with your body's appearance, whether it be weight or shape, and then the kind of preoccupation and drive that really overtakes the individual and forces them to focus almost uniquely on body. And then, of course, the preoccupation with food, exercise, and some of the other behaviors that we see these young people engage in to sort of compensate for having eaten. Things like using laxatives, vomiting, those types of behaviors, excessive exercise. So all of those behaviors, kind of core behaviors and core traits, are definitely represented in men and in women.
There you go. And in fact, a lot of boys don't even realize they have an eating disorder. But boys really need to know that they're not alone in this. That, as we said, 25% of boys are suffering with eating disorders. But they really need to seek treatment. And here's why. Because if they don't, they're putting themselves at very serious health risk. In fact, eating disorders are one of the mental illnesses that has the highest rate of mortality. That means death.
The death rate?
Yes.
Oh, wow. Okay.
Yeah, so these are very, very severe. And also these kids, because they're undernourished, and this is often happening right around adolescence when the body is supposed to be growing and developing, a lot of problems can ensue. For example, these young children can end up with osteoporosis, which of course is irreversible. They can end up with the fusion of growth plates, so they're not achieving the height that they should be achieving because they're undernourished.
Okay, question is, obviously there's a difference between men and women, boys and girls. The treatment for this, is it the same or different?
Pretty much the same. It's actually quite interesting. It's a multidisciplinary approach, and it's based on each individual's case.
So treatment can take place in an outpatient setting, in a day hospital setting, or in an inpatient setting. And that's really going to be something that's decided between the individual and the care provider. What we're looking to do is find a fit between the individual's health, their motivation, and the recommendations of the team. So it's a very collaborative process, and it does involve nutritional support, mental health and emotional support, as well as the physical support. Because of course that physical support is a big deal when you've got these young kids doing those, they call them compensatory behaviors. So
compensatory.
Yeah, the purging, the vomiting, the laxative use, the obsessive extreme overuse of exercise, all those things very damaging to the body when done in excess. So Dr. Jericho says boys need to realize they're not alone in their disease, and they really do need to seek help to avoid all of these terrible risks we've been talking about. And they may want to start by just doing some research on their own on the internet. You'll find, oh yeah, actually there are boys out there that are suffering from this as well. And then you need to start having conversations, starting first off with someone that you trust, and then with your family doctor, because then it's the family doctor that's going to give you the referral to this eating program, and you can start your treatment. So it's time to do it now.
All right, there you go.
Yeah.
Not just girls.
That's
boys.
Right, absolutely not just girls.
25%. That is still is a stat that kind of is really staggering.
It's staggering.
Actually.
It is staggering, yeah. So they're not alone, but you have to get the treatment that you really need. And really, it's so hard to get over it on your own. This treatment can last, months up to years. So get the help you need. It's
Good
out
advice.
there.
BreakfastTelevision.ca. Leah's going to put this all in her blog for sure. It's 8:47. We still have more to come this morning. You're watching BT on City.